Okay, we're going to get started now. I wanted to just welcome you all to our very special town hall today with Congresswoman Jackie Speier. We're truly delighted to be here with Congresswoman Speier on the topic of nonprofit resilience in San Mateo County. My name is Georgia Farouk, and I serve as Executive Director of Thrive, the Alliance of Nonprofits for all of San Mateo County. So thanks to all of you incredible San Mateo County nonprofits for joining us today. There was incredible interest in joining with the Congresswoman, and a very warm welcome to our Congresswoman Jackie Speier. We're so honored and delighted that you're here in conversation with us all today. I heard you're on the road, I'm not sure where. I heard Michigan last. And I know I speak for many of us when I say that your efforts in Washington and here at home are a great source of inspiration to us, especially during this time. So once again, thank you for taking time out of your busy schedule to be with us. We're truly grateful. I'm going to go over some quick ground rules. Today is really all about hearing from nonprofits, and that's why we limited this. You will not see people from private sector or government here today. It's really primarily nonprofits. The session is being recorded, as you were notified when you came in. Secondly, please keep yourself on mute unless you're called on to speak. I hear some ambient noise right now, so double check your own settings. Our team has the power to mute us all, and they will use it. So just do a double check right now. Third, when we move to the open forum portion of today, please be mindful of the fact that we have so many participants and so many people that really want to talk. Please use the raise hand feature to be called on, which we emailed you about last night. Feel free to use the chat function to share comments and questions too. Live questions or comments should be kept to 1 minute maximum. And Petra Silton, who many of you know as our Director of Advocacy and Education at Thrive, will be monitoring raised hands and will call on speakers during our open forum. So while we won't be able to get to all raised hands or comments today, we actually are committing to tracking everything and then following up with an email to the Congresswoman and sending that feedback and then keeping this dialogue going. We know we would love to have continued conversations with you all. And in terms of how this came about, I really want to talk about really briefly the purpose of today, which is to really lift up the stories of all of the heartfelt and essential work that all of you as nonprofit leaders are doing to serve our local community during an unprecedented time. So it's a time where every facet of life has been impacted by first a pandemic, and where simultaneously so much of our community is standing together for racial justice. So it's also an intersection filled with possibility. That's what we believe. But how did this particular town hall come about? Of course, it was Jackie's idea. Her office contacted us last week with a simple request. Congresswoman Speier wants to hear directly from nonprofit leaders about how you are all doing during this time, your challenges and opportunities. So here we are today. Really quickly, back in March, we surveyed the Thrive community about the impact of COVID-19, the crisis on nonprofits. We know that for you to serve your constituents, you need to have your basic needs met as well as nonprofits. And what we learned was alarming. Nearly 87% of nonprofits had already experienced or were anticipating cash flow issues. 2/3 had canceled fundraising events, and 1/4 had already cut staff hours. That was early days. So what we've seen since has been a remarkable show of resilience by the sector. Somehow, with increased financial and staffing constraints, you are all feeding, housing, and counseling more people than before, and pivoting in creative ways to continue your artistic endeavors and more. So we hope that today will help continue this narrative and fill in the gaps, because we know that statistics don't tell the full story, and they don't describe the way the community has stitched together solutions and the way that our sector, and this is really important, will continue to need investment and nurturing in the months ahead in order to fulfill our missions. With that, our agenda for today's town hall is very simple. First, we'll hear an update from Congresswoman Speier on her work in DC and at home. Then we'll hear very brief updates from nonprofit representatives from our key issue areas that we're working on at Thrive. And then finally, we'll open it up to dialogue with the audience with a commitment to following up. So now it is my very great honor to introduce our very special guest for today, Congresswoman Jackie Speier. is a fearless fighter for women's equality, LGBTQ rights, and the disenfranchised, who has dedicated her life to eliminating government corruption while working to strengthen America's national and economic security. She was named to Newsweek's list of 150 fearless women in the world and one of Politico's 50 most influential people in American politics for bringing the Me Too reckoning to Congress. She proudly represents California's 14th congressional district, stretching from the southern portion of San Francisco through San Mateo County to East Palo Alto, and serves on the House Armed Services Committee and as a chair of the Military Personnel Subcommittee on the House Permanent Select Committee on Intelligence and on the House Committee on Oversight and Reform, where she serves on the subcommittees on Environment and Government Operations. Speier is also co-chair of the Democratic Women's Caucus, the Congressional Armenian Caucus, the Bipartisan Task Force to End Sexual Violence, and the Gun Violence Prevention Task Force. Congresswoman Speier, thank you so much. And take it away.
No, I'm okay now. Okay, thank you.
Okay, Elizabeth sent you an email.
Hello, can you all hear me now?
Yes.
Yes.
Yes, okay. So my backdrop is actually the view from the cabin of the lake in Michigan where we vacation each summer. So is that pretty phenomenal to see what sunsets are like in other parts of the country? In any case, thank you all for joining. The fact that so many of you have requested to be on this call suggests to me that I need to do more engagement with you, and I will commit to doing so. I wanted to talk with you directly because we've been focusing on groups. We focused on small businesses. We focused on the hospital units and whether or not they're accessing the PPE. And this coronavirus crisis has made us triage, which is what we've been doing for the last 6 months. Excuse me. But the CARES Act was certainly a first step that was appropriate when we thought it was a 2 to 3 month experience. Now we know that we're looking at a year to a year and a half. And I think that everything we do now has got to be looking at the greatest need. And I wanted to talk to you specifically because I want to hear about the greatest need. So since we have so many of you on the call and so little time, the extent to which you can put your questions into the chat room, either Georgia or Katrina can curate those and maybe combine 2 or 3 questions so we can get to as many questions as possible. I know one of your questions is, what's going to be passed? What negotiations is going to result in? And I would say that we still don't know. There's some good signs in that the Republicans on the Senate side have now come up from $200 a week to $400 a week, which is a huge step forward, believe it or not. And the speaker is standing firm at $600 a week. I know I'm getting calls into my office saying, please just do something because we can't survive. And I appreciate that, but it's important to make sure we maximize the benefits to each and every American when we have, frankly, a recalcitrant Senate that's interested really only in maybe extending the PPP program and creating benefits for big business, which is not what you and I are involved in. I will say to each and every one of you, I've stood in distribution lines for food and helped load cartons into cars and bag food at many of your facilities, and I can't imagine what we would be looking at without you. I mean, you have been the fabric that has kept everyone in that safety net. And I'm deeply indebted to you and grateful for all that you've done. So as we look to what's next, I want you to be to the point and as brief as you can be, and give me a real sense of what the highest need is in each of your areas. So I'm going to stop there and let's get right to the presentations and the questions. And I understand you've got 6 presenters. Please keep your comments to 3 minutes. I think Katrina is going to hold the clock and make sure that we can.
1 minute.
What is it now?
1 minute.
Oh, it's now 1 minute. Okay. And so we can maximize how many of you can be heard. Thank you all for being on the call.
Thank you, Congresswoman Speier. So we're going to move right into the program with our speakers. So we have 5 issue areas that we work on at Thrive. They're arts and culture, children and education, environment and sustainability, immigrant and workers' rights, and basic needs and safety net, along with civic participation, which runs through all of our areas and really is focused on census and elections work. And we thought that this would help give a snapshot on the needs of all parts of the nonprofit sector. So we are gonna jump in and bring on Max Koknar from our Arts and Culture Group, who's co-artistic director of Dragon Productions Theater Company. Max, please unmute yourself and in 1 minute, tell us what's been happening in an area of the nonprofit sector that's often overlooked during times of crisis.
Thank you so much. I prepared a quick little statement, and I will try to make this as brief as I possibly can. Art for millennia has served as a tool for community building and understanding. Art allows us to innovate on a social level through the power of what if. Art inspires scientists and politicians. Art sells products. Art can move an entire generation to action. We resort to art to reimagine the possibilities of the future, even in the face of harsh realities of the present. And today, the artists who make that possible are some of the hardest hit by this pandemic. I make theater. I can tell you that our theater buildings will not be back open anytime soon. The artists who relied on institutions like the Dragon for their livelihood are looking at a gaping chasm of uncertainty where their future plans used to be. Of the approximately 31 million currently unemployed in the United States, over 1 million are arts workers. And this week, with the end of the enhanced unemployment benefits, many are faced with the very real possibility of homelessness and hunger. By May, 95% of all artists and creative workers had lost income due to COVID-19. By the end of June, unemployment in the arts sector had grown by nearly 900% in comparison to the same time last year. Yet, the arts and artists still persevere. Over the last 5 months at Dragon, I watched the arts create some powerful bonds between folks who've never met in person. I've seen arts give hope to folks who were beaten down by the disease and isolated and alone. I've seen instant communities crop up at online arts events. I have seen connection across tens of thousands of miles between artists from the Fillmore district of San Francisco and Ghana, West Africa. I've been watching artists reinvent themselves and reimagine and innovate in the face of impossible odds. Artists can help us reinvent and reimagine our society. Artists can be the second responders to a crisis, not by making art for art's sake, but by collaborating with experts in other fields. Artists can support educators to increase engagement and comprehension and create a sense of community among students in the face of distance learning. Supplemental services by artists and intentionally designed arts participation opportunities increase positive outcomes in social service, healthcare, correctional settings.
Thank
but to be able to create those,
we have to cut you off now, but that was really powerful, and really appreciate you representing the arts community here today. And I'm sure we'll hear from more arts and culture people. We'd love to bring on from Children and Education. We have 2 speakers. I'd love to bring on Aubrey Merriman, who is the CEO of Boys and Girls Club of North San Mateo County. Thank you, Max.
Thank you. Good afternoon, everybody. Can you hear me?
Yes, we can.
Wonderful. Congresswoman Speier, I just wanted to say what a pleasure it is to see you again. I am sitting here in a small town you might know by the name of South San Francisco. And so it's really an honor to work in the footsteps of where you began your illustrious career. Boys and Girls Clubs in North San Mateo County continues to inspire and enable young people to realize their full potential and contribute to their communities. We've been doing that for over 70 years, and we focus on who we feel are those kids that need us the most. We know that across sectors, the pandemic has created a perfect storm of increased needs and increased cost. And as government programs and unemployment remain unstable or unavailable to our families, Boys and Girls Clubs must fill the increasing gaps where public resources fall short. And for many of the kids and teens that we serve and that others serve, the pandemic will have brought significant trauma and stress where they were facing that even pre-pandemic. And so any recovery response must ensure that the kids have the proper supports in place so that they can cope with this experience in a positive way and address social, emotional, and mental health needs and concerns, improve academics, belie learning loss, and develop social, emotional skill sets. And the question that I have is, has there been thought around a sort of a PPP program, a forgivable PPP program targeted to nonprofit community-based organizations that are being called on increasingly to fill the gap between distance learning and the realities of the lives of the students that are being impacted by that. And I think the fight for survivability and being liquid is really so overwhelming that it's taken away from the ability to step back and say, how can we really show up for our kids in our community when we're equally concerned about keeping our doors open? So is there thought around a PPP type of program that's forgivable, that focuses on youth-facing, youth-serving agencies, especially during a time where the responsibility is falling more and more on us to fill that gap? Thank you for the time.
You are aware that PPP is available to you, correct?
Oh yeah, no, absolutely, absolutely. And we're aware that we had applied for that. I was just thinking more along the lines of selfish sector reasons. Is there an opportunity to have a pocket, a pool of funding support that is really targeted, particularly in this era and this time where the extension of the pandemic and the shelter in place and the distance learning has really created reduced capacity but increased cost for nonprofits and community-based organizations just to operate at lower capacity. So that financial stability and support is extremely helpful during this time.
Okay, thank you. There was some money in the HEROES Act that was set aside specifically. Again, it's problematic because we just don't have the agreement yet. And I think what I'm going to do is actually host another town hall with all of you once the agreement has been signed and delivered, so I can go over the specifics with you. All right, our next presenter, please. Thank you both, by the way.
Next, we have Heather Cleary, who is the CEO of Peninsula Family Service.
Hi, everyone. Thank you, Congresswoman Speier. Peninsula Family Service serves over 450 children in a non-COVID year, and our capacity has been cut by about half as we've opened back up, and this is 0 to 5 services. So what I'm seeing is a really unsustainable business model for any childcare provider. Serving half the number of children and getting half the amount of revenue in many cases is a big crisis. And I fear our infrastructure is crumbling and will disappear. And without this infrastructure, many parents will not be able to go back to work. Many children won't be able to start kindergarten prepared. And it's a big challenge in this community, but across the nation. The other thing that I'm seeing is a really decentralized and unfunded approach to education and care that really increases our public health risk and decreases the education quality. What we need, children need education, and they need it by caring people, and parents need to go to work, and we all need a system that supports all of these activities. Thank you very much for your time today.
Thank you.
Thank you so much, Heather. Now we are going on to environment and sustainability. We have Ophelia Bello, Executive Director of YUCA, which is Youth United for Community Action, which works on social and environmental justice issues.
Hi, good afternoon. Can you all hear me okay? I was having a bit. Okay, great. Thank you. I'm gonna keep my video off. My apologies to be able to make sure that my audio stays okay. Thank you for that introduction, and good afternoon, Congresswoman Speier. It's a pleasure to be here and talk to you all among these amazing group of nonprofits. One of the things that I wanted to highlight is that at UCA, we are both an environmental justice and a social justice organization. What that means for us is that we take an environmental justice lens to many of the social justice issues that we face. Right now, one of the big things that we really can't turn away from is the crisis that our renter community is experiencing here in San Mateo County, across the state, across the country, as I'm sure many folks on here know. And we're really not getting the support to help stabilize our large renter constituency that we hope to be getting from our more local players, if you will. I say this to say that, you know, any support that you could extend that could come from the state, that it has literally very pointedly been said from our county, from our local elected officials, that the support is desired from the state. So, you know, for us, when we talk about environmental justice and social justice, especially on that front with on the renter issue, it means issues of preventing homelessness. It means issues of addressing, you know, less than habitable homes. It means addressing the issue of maybe housing units that are really not conducive to a learning environment where many of our young people are having to do school from these days. So that's one of the biggest things that we've been having a hard time elevating to get the attention and priority that it merits. And it has a huge impact on our ability to be resilient as a county and our ability to bounce back. So that's one of the main things that I wanted to speak on today. And thank you so much also for your time.
Thank you. Thank you so much, Celia. Now we are going to move to immigrant and workers' rights. And we have Stacy, I think we have actually, do we have Shirley, Director of Directing Attorney for Housing for Legal Aid Society of San Mateo County? I believe we have on.
That's correct, yes.
Okay.
Stacy and I are swapping spots here, and thank you so much for your time today, Congresswoman Speier. Our immigrant and workforce work at Legal Aid Society is really central to our advocacy for low-income populations, because that is such an essential sector of the low-income residents and workforce. And the immigrant households in San Mateo County are amongst just the hardest hit. They're bearing the brunt of infections, of lack of survivorship when they are infected, living in overcrowded housings that are situations where it's just not conducive to quarantine, and the spread of the virus is rampant. The economic impacts are also disproportionately hitting our immigrant household neighbors. People largely holding jobs without sick leave, really not having the choice to stay home sick if they have to earn in order to support the household, and without the unemployment benefits eligibility that other sectors enjoy. So it's forcing our immigrant households into an impossible situation. And the greatest driver of that is rent debt. As Ophelia referred to, one of the saddest aspects of this is driving people into desperate situations where they can't do what the public health recommendations would indicate, because they are just beholden to landlords if they are going to maintain a stable housing situation, have a place for their kids to do the schooling that they need to do, and have a roof over their heads in which to shelter in place. So the greatest thing that we could see done for the immigrant tenant population, for our low income populations, for our wage and hour workforce, is for them to not owe rent. That is the essential solution here. It is way too big a solution for local governments to grapple with. We've seen an unwillingness and inability locally. and even at the state level. And so we need a federal solution. We need a federal solution that's not a bailout, because this is not 2008. We're in 1933. This needs policy.
Right, you're absolutely right.
In addition to funds.
The HEROES Act actually had about $3 billion set aside for renters assistance and for eviction prevention. So the extent to which we can get that into the negotiated deal, there will be money specifically to pay off rent for low-income residents. It's a matter of whether or not we get it in.
And financial solutions are important, but they're not meaningful without regulatory strings attached to those financial solutions, because we're talking about applying tens of millions of dollars to hundreds of millions of dollars problem in our county. We're already shoveling rental assistance into the problem. More federal funds would be great, but if we're giving money to the property owners, giving money to their lenders in order to obviate the rent debt, it needs to come with the regulatory strings that people will not be evicted. So we need to be fearless about regulating.
Thank you, Shirley. Thank you so much. Now we have Jessica Ho, who is Government Affairs and Community Liaison for Northeast Medical Services, to speak as part of our Basic Needs and Safety Net initiative.
Good afternoon, Congresswoman. Thank you so much again for taking the time to speak with Dr. Kenneth Tai, our Chief Health Officer, and myself at the beginning of the pandemic. With your advocacy, we were able to start up our telehealth operations at the beginning. And since we last spoke, NEMS has quickly transformed how we deliver care to meet the challenges of shelter-in-place orders. And when the shelter-in-place orders were first implemented, the number of patients that usually came in dropped by 90%. Thanks for your help, we were able to provide telehealth and continued care for our patients, and also telehealth and being able to manage their care virtually. My question to you actually is something that I would like to hear is what you see as the future of telehealth. And also, are you supportive of telehealth being, to continue our telehealth flexibility moving forward?
So I enthusiastically support telehealth, and we have obviously made that reimbursable through the pandemic, and I feel strongly that we should continue it after the pandemic, because it's a very good way of providing health care to people in need who have difficulty getting to see the doctor, and yet in a telehealth situation, they can get the same care. And physicians and physicians' assistants and nurse practitioners are very supportive of it as well. So I think it's here to stay. The actual participation rate was very low before the pandemic, something like 30% in many of our hospital settings. It's jumped way up to about 80%. So I think we're on a right track there. Thank you.
Thank you.
Thank you, Jessica. Now I'd like to bring up Bart Charlo, CEO of Samaritan House, also as part of our Basic Needs and Safety Net.
Hi, Jackie. How you doing?
How are you?
You know, I want to thank you, as I'm sure all of us do, for everything that you do every day, but especially during this crisis, you've been extraordinary. You've been on our food line, so you got a pretty good idea about what goes on. What you probably don't realize is that food and food insecurity is enormous in our county right now. We've had to ramp up over an extra 100,000 meals per month just to handle what we do out of Samaritan House, and there are many of our fellow agencies doing the same. We can do it because we've got excellent partnerships with one of the best food banks in the country and with the local grocery outlets. But there is a huge challenge in terms of distribution, connecting that food with the people who need it. The biggest crisis, you heard from Shirley and from some of the others, is really the rental crisis. And this is going to take more than money, as she was telling you. Give you an idea what's going on here. We've been processing more than 4,300 applications for rental assistance. That's about $9 million worth. And it's just the beginning, because as soon as the eviction moratoriums end, people are going to come crashing down the doors. So it's absolutely imperative that we not only get the short-term financial assist to help people stay housed and not become homeless, but at a policy level, at a much higher level. What we need is a national get together, I don't know, with the federal government putting together the financial markets, the actual landlords and the renters associations, and take a look at what can be done to reorganize this. Think of it as a Chapter 11 kind of reorganization for the whole sector, because without that, we're going to have an unbelievable homelessness problem. We thought we had it bad before. You've seen nothing yet.
So Bart, when you're providing rental assistance now, even though there has been this moratorium on having to pay your rent, people are coming in to pay their rent? Is that they're seeking help to pay their rent, or are they using the money for other purposes?
Well, they're probably using it for both, but we distribute most of it for rental assistance, and they do want to pay the rent as they're going along. As you've heard, there are landlords who, despite the eviction moratorium, are pretty unscrupulous and putting a lot of pressure on these low-income renters. But one way or the other, nobody wants to get so behind that they find themselves out on the street when the moratorium ends.
Okay, thank you.
All right, thank you, Bart. And now we'd love to bring up Lisa Teeler, Executive Director of Bay Area Community Health Advisory Council, to talk about civic participation.
Thank you for this opportunity. Good afternoon, Congresswoman Speier. Our organization's been around about 25 years. Grassroots, focused on health disparities, was formed by concerns of African Americans in San Mateo County, specifically Gloria Brown, who I know you know, and various other individuals know. In terms of our immediate impact, we're seeing funds for the work that we do being cut or redirected. So several of our programs are in jeopardy. Our community mammogram program, giving free mammograms for women, uninsured women. Our men's program with prostate screening, et cetera, has been significantly impacted. But I am going to be talking about some of the civic participation around the census, because we are participating in that as well. And we're quite concerned about the hostile environment that has been created for our immigrant and undocumented community members. First, we had COVID, and that impacted our outreach efforts to get people counted. Then last month, the president gave a memorandum to the Commerce Department around not counting undocumented individuals as part of the census count. And
it was just to scare people, that's all it was. It was an effort to try and depress the count. But my understanding is that San Mateo County, that we're among the best in the state, if not the best. Isn't that right?
We are doing well. I will give hats off to my folks at the county, other CBOs and others. We're doing quite well, but there are folks that are not being counted, and it's the hard to reach. So that's our undocumented folks, people who speak English as a second language. And they are very fearful now because of the things that have happened. And then this week with the cutoff of the census going from October 31st to September 30th, that has now kind of doubled down our efforts, and we're already stretched to make sure those people are counted, represented, and the funds go to the communities that deserve it. So I'd love to hear your comments around that, what's happening in the Capitol around the messaging around that, because the folks that are undocumented, and it's not just the Latinx community, it's also our Pacific Islander community as well, that are very fearful of completing that because they're because of the hostile environment that's been created. So thank you.
Well, it certainly was intentional. It was intentional from the very beginning to try and suppress the census, to not count persons that weren't citizens, even though, that hasn't gone on since the 50s, and then to shorten the time frame. I would not be surprised if there's a change of administration, if we didn't extend it into the first couple of months of the new year, because it's so significant in terms of federal funding for communities, as you well know. So we continue to push on it, and I feel that in the end, we will make sure that we get an accurate count. Okay, can we now open it up to questions?
Yes, thank you so much to our spotlight speakers, and Petra Silton, our Director of Advocacy and Education, has teed up some questions for us. So she's been monitoring the raised hands. Petra?
Hi, Yes, I think Tracy Weatherby from the Food Bank.
Hello, Representative Speier.
Hi, how are you?
Thank you so much for being here. And you've also been on our food line, so I know you've seen that. You know, just at the top level, I just wanted to continue to highlight the food insecurity across both these counties, and the fact that we have nearly doubled the amount of food that we're putting out there, and we're now serving over 500,000 people across Santa Clara and San Mateo counties through wonderful partners like BART and Aubrey. You know, we have over 300 partners. But we are really seeing, you know, no end in sight. In fact, we're worried about it getting worse. So if we can continue to keep food banks in the mix, you know, the USDA is still sending some food our way, but the staffing needed for boxing is a huge challenge. And then just the facilities, we've rented an additional warehouse down in San Jose to try and accommodate. You know, it's kind of crazy the amount of food that we're dealing with now. And the last stat I just wanted to share is that we used to distribute 22% of the food that we put in the community to San Mateo County. And during COVID, that's increased to 33%. So we're really seeing a much higher need in San Mateo County in this time frame. Thank you for all you're doing.
So historically, the food bank, 2/3 of it goes to Santa Clara County?
Yeah, Santa Clara is a much larger county, and so it has been the case that more of our food was distributed there. About a quarter typically was in San Mateo County, but we've really seen that rise. And as you know from visiting, we're distributing a lot more food in North San Mateo County now.
Right. Okay, thank you so much.
Thank you.
Thank you, Tracy. Brian Nider from Abilities United. Would you like to ask a question?
Sure. Hi, Congresswoman Speier. Thank you for being here. And we all, I know I speak for everyone when I thank you for making time to hear from us. Two things, kind of, I would say a little bit of now, but also kind of as we work through the pandemic and come out the other side. One that's been touched on around the edges a little bit, but is the digital divide that we're experiencing in serving our community. It's multi-layered. It's not just the equipment needs, tech support, Wi-Fi hotspots, but a lot of families that we serve, certainly individuals, you know, we serve primarily individuals with developmental disabilities, being able to have hands-on support to make services accessible to them, especially when we're talking about telemedicine. There needs to be, you know, obviously resources available for all of us, many of us on this call, to be able to make and close that gap so that services are available. Pre-pandemic, we had hourly workers having to take off maybe as much as 15% or 20% of their hours in a week to get their children to therapy sessions because of traffic. Teletherapy adds a whole nother dimension. We're serving over 85% of our clients with teletherapy and 100% of our adults that we serve. So it's a great opportunity, but at some point there has to be resources available for us collectively as a community to make sure we can close that digital divide. The other piece is around funding to be thinking about post-COVID. So everyone, you know, certainly laid out the needs which are significant that we have right now. But coming out of COVID, it's almost like we're going to have to deal with restarting all of these businesses that have been underfunded. Because right now, if we want to use kind of the emergency room analogy, we're stopping the bleeding. At some point, the patient has to get up and has to go through therapy and recovery. And we're going to need resources on the other side of that. In the nonprofit space that we serve, we're seeing and hearing from other agencies that may not be able to survive this. And we do not have resources to be able to go consolidate and bring on those client loads and hire those staff to be able to meet the needs. Otherwise, we're going to have a lot of folks without service. So kind of in this recovery phase, but also supporting in the immediate need, what do we do to make sure services don't go away that can't be solved just with funding that came under PPP, because that's to keep payroll. This is about helping provide services for agencies that may not have the resources to stay afloat. So thank you again, Congresswoman Speier. Appreciate your time.
Great to see you.
You too.
Thank you, Brian. And I'm sorry I forgot that you have a new name, Ability Pat.
No worries.
Have we changed it again?
We did change it again. We have it on the calendar. Every decade we come up with a new name.
Okay. Yeah. I'm showing my age when I used to work there as popular recare.
Excellent. For our next question, I want to take someone who raised their hand, Lucy Lato.
Hi, thank you so much. Can you hear me?
Yes,
we can.
Oh, perfect. Thank you so much, Congresswoman Speier, for sharing your time and your experiences with us this afternoon. My name is Lucy Latu. I am a resident here in San Mateo and also an employee of County of San Mateo, but at the medical center, I practically work 7 days a week. But on the other side, I'm also working for the nonprofit of Daulama for Tongans, which serves the Pacific Islander community within San Mateo County and Alameda County. But with San Mateo County, we all understand that with COVID positive cases, that there were laboratories and healthcare systems within this county are required to report those cases to public health, to communicable diseases department. And unfortunately, the race, ethnicity, and language, along with SOGI, which is sexual orientation and gender identification information, isn't mandated. And with that, with the cases that we have, there's a huge amount that are just, when you break it down for the ethnicity, with race, what's hitting the, what specific group is being hit with it hardest, it's a large unknown group or other. And the community needs assessment that the County of San Mateo had released the report. They had identified that the Tongan community had a morbidity age of 65. That meant that we were dying at as old as 6. That was the average age. And the next ethnicity group that was dying was with 20 years from our age, which was the African American community. And so the county has already identified that our community is definitely one that's being faced with disparities and inequities as far as healthcare. I know that you're at top level and high level with being at the nation, and I know our numbers are small compared to many other ethnicity groups, but what can we do in order to properly, it goes along with the census, properly help those communities that really are being lost in the shuffle? And because at this time, my community is suffering and dying, and they're not being identified because we're just other, and we're not other. We actually do matter, and we do count.
Very good point. I do know that in San Mateo County, 80% of those who have died were in nursing homes. But to your point, we don't know about that 20% in specificity that we should. And I do think the county is attempting to refine its data collection to get more specific. We should do more on the federal as well. So thank you for that. I think that the most important thing is to get the word to people about the importance of doing those simple tasks that we keep hounding everyone about: wearing a mask, washing your hands, and keeping that 6 feet of distance, which surprisingly is almost as important as wearing a mask, because we tend to want to gather closer to people. It's just normal interactions, but maintaining that 6 feet is really important. And that whole issue about outdoor dining, which I have enjoyed, but I must say it's hard to keep 6 feet distance. And as we have retrenched a little bit, I encourage people to do more of the takeout at restaurants than what was starting to happen with the outdoor dining. Next question.
Thank you. Rod, would you like to go next?
Oh, yes, thank you. Good to see you again, Congresswoman Speier.
Rod, how are you?
Yes, I'm fine, thanks. So, as you may know, this fall, every school will be closed for the start of the school year. So the fundamental question is, where will kids be able to go while schools are closed? We have 1/3 of our workforce in San Mateo County who are parents with kids 0 to 18. So if there's going to be an economic recovery, we need to be able to solve this problem. I happen to lead a nonprofit called In Play that helps connect low-income families with out-of-school time programs like summer and after school. But now we need programs that can serve kids all day. So working with Georgia Farouk, Thrive, Roseanne Faust at Samsida, David Fleischman at 4Cs, and many other nonprofits, including Aubrey Merriman and Heather Cleary, we have formed an ad hoc task force to develop a solution around this. What we're finding is that we have providers who have staff and money, but no space. We have providers who have space and staff, but no money. So what we're trying to do is knit together multiple stakeholders from around the county to be able to support these out-of-school time providers who are willing to serve the students. Amazingly, we believe through the help from Roseanne Faust that we may be able to get free space, which would reduce the cost of operating these programs by roughly 40%. In 2 weeks, I'm working with Georgia Farouk and David Fleischman to sponsor another county-wide convening of these out-of-school time providers and childcare providers. Last time we did this, we maxed out the Zoom registration of 500. So I want to let you know that we are developing grassroots solutions here. And I'd actually like to invite you, if you are available, to offer some brief opening remarks on August 20th to kick off this large convening for after or out-of-school time providers and childcare providers.
Okay, let me check the schedule, and if I can, I certainly will, Rod. You know, I'm also wondering, there's a lot of commercial space right now that is unutilized. Yes. You know, a lot of auditoriums. I'm thinking of huge places within Genentech and Facebook and others. Yes. Has anyone approached them to be able to access that
so
space?
That's what Roseanne Faust is helping us with. And we've talked with commercial realtors. They're saying, this is an easy ask. There are owners who, truth be told, a lot of the businesses are trying to get out from their leases. So there's a lot of commercial space inventory that's going to come on the market. And any owner that donates space gets a corporate tax deduction at the fair market value. So you're thinking along the same lines. Let's leverage that.
You know, a lot of the hotel space is also available too. And they have large dining rooms and places that you could utilize and do social distancing as well. Yep. So very good.
Yes. So I'll send information to your staff. Thank you.
Thank you. Who's next?
Thank you, Rod. Pamela Ward raised her hand. Unmute yourself.
Pamela, are you there?
Yes, I'm unmuting myself. Good afternoon, Representative Congresswoman. I'm sorry.
Yeah, just call me Jackie, please.
Jackie. From one fearless woman to another who's faced trauma, I want to tell you about a program in San Mateo County, some good news, and also some needs that we have. I am a consumer of mental health services and a consumer advocate who serves on the board of directors of Heart and Soul. Heart and Soul is a peer-founded, peer-run, and peer-led mental health community-based organization that serves San Mateo County and has been since 2005.
You know what, Pamela, we're having a hard time.
Values of love, hope, resilience, and community. Heart and Soul has been able to sustain services to.
You know what, Pamela, I'm sorry.
Move on to the next one. The audio is just audible.
Yeah, we can't hear you very well. Yeah, we'll move to the next one.
Currently offering virtual programming such as wellness activities.
I'm going to call you and have someone in my office call you and hear your presentation.
Yeah, we'll make sure you get that information. Congresswoman.
Let me say in closing that Heart and Soul.
Sorry about that. We can't hear her. So we will move on to Anne Marquart from Project Sentinel.
Okay, can you hear me? Okay.
We can hear you and see.
The Project Sentinel provides housing counseling to low-income tenants and property owners as well to resolve tenant-landlord disputes. And our phone calls have doubled since March of this year. And I want to just say that I totally support all the information that Shirley Gibson gave from Legal Aid, that we need not only the financial support, but we need to have that be backed up with legislation, with regulations that will control, let's say, the onslaught of what we believe is going to happen with evictions. And tenants cannot, low-income tenants have had a hard enough time paying their rent before COVID, and nobody can sustain a growing debt of rent moving into the future. We do have a small experimental program where we're asking tenants who are able to pay some of the rent what they can pay, and then we're going over to landlords and asking them how much they can reduce their rent by, and then we're even going to extend that to the banks and ask if they can reduce the mortgages by anything. And we have some small amounts of money from some cities down in Santa Clara County to then kick into this pot. And we're just going to see how that can work out for those tenants who have some money that they can contribute to the rent. But we hope that there will be tax credits for landlords who do forgive some of the rent payments. And but the small mom and pop operators and their mortgages have us at great concern, because those represent lower income. The small mom and pop operators rent units to lower income households. So we're very concerned that there's no mortgage foreclosure protection for them. And anyway, they just need to be taken into consideration there if we want to keep that low income housing stock available. So basically, that's what I wanted to say, is I do hope the tax credits can be given to landlords who forgive rent, and that we have to protect tenants from a growing debt of unpaid rent. So anyway, thank you very much.
Thank you.
We're going to go to Cardam Harmon, who actually is the CEO of Heart and Soul, where Pamela was from, so that they can have their chance to speak. Cardam, are you able to unmute?
Sorry about that. All right, you guys can hear me?
Yes, we can hear you.
Great. Yeah, I wanted to thank Pam also for your presence here. So I just wanted to share that at Heart and Soul, we're really working to transform the traditional mental health system by the use of peer support. And what this does is reduce dependency on county services as people become more secure in their own recovery journeys. Basically, they are really inspired by our peer mentors, by seeing what's possible. They see our peer mentors employed and hospital-free. Through our HOPE program, which stands for Helping Our Peers Emerge, we're helping to reduce hospitalizations and increase opportunities for community integration, especially for those who've been experiencing high levels of hospital recidivism and life in locked facilities. So we're in partnership with other peer agencies like the California Clubhouse, and what we do with them is support people with mental health challenges in job readiness. We're also supporting those diagnosed with severe mental health challenges to re-enter school, like Kaminar's Peer Support Specialist Training Program, and also reuniting folks with family through organizations like NAMI. So we have many programs. One of them is our Total Wellness, which supports peers in staying well in the midst of isolation and sheltering in place, which is reducing their mental health crisis and visits to acute care facilities. We're doing this by having phone, Zoom, Facebook Live, and we're seeing an average of about 600 wellness engagements per month. This is thanks to a low-cost monthly tech plans via a government program which provides phones and tablets for our peers. We purchased about 38 phones and tablets, and we're realizing that our need for more technology to support virtual activities is going to grow. Basically, with sheltering in place not really changing very much. The virus,
how many peer advocates do you have?
Total, we have about 16.
Okay.
Yes. And then we also have a supportive employment coordinator through California Clubhouse. So basically, we're going to need more technology, and then as well funding for the continuation of our HOPE program services beyond June 2021. So it's a bigger conversation to have, but the low-hanging fruit is that we certainly have a need for more technology.
Okay, thank you.
Thank
you very much. Next, Jeff from El Centro.
Hi, Jackie. Thanks for all the work that you're doing for us in Washington. On our part, we're very appreciative of it. The question I have, I'm with El Centro de Libertad, and we provide outpatient services for drug and alcohol rehabilitation and other destructive behaviors. We're actually doing okay through the PPPs and other grant opportunities. We've kept all of our people working, and we're keeping our head above water. We're very dependent on contracts with county agencies to keep the money turned on so that we can continue to provide these services. And they are in a big way dependent on state funds to make that happen. And as we know, virtually every state is going to see devastating budget damage due to COVID. So in the HEROES Act, or in the negotiations around that, is there serious conversations about reimbursing the states from federal money? And I asked this question earlier in chat. During the last distribution of funds, we saw a lot of stories about Chinese-owned companies or major corporations traded on the NASDAQ that were receiving PPP funds. And we know that the guy in the White House kind of got rid of the accountability piece before that went into play. Is there talk about accountability with this next batch of money? Thank you.
Yes. The HEROES Act had $1 trillion for states and local governments. The Senate has been unwilling and unpersuaded that states and cities need these resources. It's very hard to believe. And they don't realize that if we don't fund states and local governments, there's going to be more layoffs, the unemployment rate is going to grow, and it's only going to get worse. So that's still being negotiated. That's one of the reasons why Speaker Pelosi has not caved to their negotiations. And she has made that a very important component. In terms of the accountability with the PPP program, you're absolutely right. It was rolled out very quickly. It didn't have the kinds of constraints. And frankly, banks made money on all of these deals, and they did not provide, I think, a level of review that could have taken place. Chinese-owned companies owned by the government of China should not be getting PPP money. But the good news is that there's still $130 billion available for PPP loans. So for nonprofits that have not sought the money yet, I urge you to do so. And I think it will be continued, and there may be some opportunities for a second round of PPP loans to those who've already received it. We're going to have to close pretty quickly here. Are there any more questions I can answer rather rapidly?
Bernie, are you available to ask the last question from the Ombudsman Services from San Mateo?
My question. Hi, Jackie. How are you today? Good?
My biggest question is, what we're finding in the Ombudsman Services for San Mateo County and all of our residents is that they're receiving eviction notices because first, they cannot make the payment for their rent in the long-term care facilities. And in many cases, the families were helping them, they've lost their jobs. And so here we are with 80-year-olds, you know, on the verge of being homeless. We cannot have that in San Mateo County. We can't have that in the United States. So my question is there a way that perhaps some kind of a fund or something could be established to be able to subsidize the money that these seniors are paying? But there's usually about $1,000 to $1,020. That's the discrepancy. And I'm looking for a way that we would be able to help these residents, and there's almost 10,000 of them here in San Mateo County, to be able to stay and age in place and die in place. To be very honest, we can't have them on the street. There's no place for them to go.
Right. No, I'm very grateful that you brought this to my attention. How many older nursing home residents do you think fall in this category? How many are we talking about, would you say? You've been muted.
We're doing a spreadsheet right now, and I'll have it ready on Monday because they don't know who to turn to. And they're, and I'll call them landlords for a better word, but the people who own the residential care facilities cannot, you know, try to give them a break. Some of the big companies could, but they don't. And the little 6-bedroom facilities, they have to survive. So it's at the dilemma, and it's growing. And so Monday I'll have specific names and places where these people are right now, but I really don't know who to turn to be able.
Well, the ones that are in the, they're not assisted living, they're board and care facilities, I think is how we would define them. I don't think they have the right to evict them.
Well, that's what I'm thinking, but right now they're.
But we should, I'll ask the county to get an opinion on that from the county council.
Okay.
That, and then please get that information to me. I'd like to follow up with that as well.
I will. So thank you very much.
Thank you.
Congresswoman,
all right.
We're out of time, but we just wanted to say a big thank you on behalf of Thrive, all of the nonprofits. This has been really helpful, heartening, and delightful to be in your presence too, and to be talking with you. So we hope that we get to continue this. We're really eager to continue the conversation with you. And I just wanted to let everyone know that we are compiling your comments, and we do have a list you know, that you can opt into, that we can share if the group wants to stay connected, and we will continue keeping you all together. And then many of you are already active with Thrive, so we will continue meeting with you. But I wanted to pass it over to Congresswoman Speier for closing remarks. Thank you so much for everything.
Oh, thank you very much. I just want to reiterate again what I said early on, which is you are that fabric that is keeping those in greatest need in our county uplifted. And as you think of things that we might be able to address, I hope that you'll call the office and let me know. And also, once we do have a new bill that is signed, sealed, and delivered, I will set up another call to bring you up to speed on what's in it, so you'll know. And to Max and Ophelia and Heather and so many of you that did the presentation, thank you very much for making the case that you did so aptly. I also would like to know how many of you actually received PPP loans and how many of you did not but had applied. That would be very important for me to know. So if you would convey that to me, leave it on the chat, that would be great as well. And with that, I'll say good evening, and it's evening for me. It's still midday for you. And stay well. Please stay well. Thank you. Thank you again, Georgia. Bye-bye.
Thank you. Thank you, everyone.